Good morning, everybody. Today, my topic of discussion is fat dissolving injections and its collateral analysis as compared to other modalities available in the market for fat dissolving. Since a very long time, fat is our friend, and we know fat is around us since late 80s and late 90s. Obesity is now, it's like a tsunami which has taken over the world by its horrific outcomes. And science and research has been trying a lot to give us solutions regarding the fat deposition and how to move fat. And frankly speaking, when I thought of having this idea of opening a aesthetic clinic, uh, I never thought, and this was never in my mind, that fat dissolving and fat presentation and obesity presentation in my clinic will be in such a large number that I will have to give a proper solution to all my clients. When you have so much presentation of people coming to you with obesity, and my experience about the fat, it started long way back when I was working as a gynecologist and infertility specialist in those days. And actually till today I am on my toes trying to ask my clients suffering from polycystic ovarian syndrome to suffering from lower or smaller eggs, and all the girls and women suffering from polycystic ovarian syndrome and many other hormonal issues which are diagnosed under this diagnosis of hormonal imbalance. So for any woman to conceive, I had to, and I have to still today, ask them to reduce a lot of weight. And reducing weight means like reducing weight in stones on like at the weighing scale, or losing the fat in thickness, like the amount of inches from their back and amount of fat from their love handles and their back and their shoulder and thighs and everywhere. Because as a doctor and as a physician, we know that the correlation between the infertility or subfertility in both men and women is directly reciprocal to your is directly reciprocal to your fertility index is directly reciprocal to your weight. The more weight you gain, the less fertile you will be. And the less fat on your body, the more fertility you will have in your sperms and more fertile eggs you will have in your ovaries. So as a gynecologist, my experience with fat reduction, it goes way back than today as an esthetician in my clinic. But when I started the clinic, I was like astonished with the number of crowds and people showing up daily asking me solutions for the fat, not only for aesthetic or beauty reasons, or some chiseled jawline, or a neck very smart and fine, or somebody who wants to have a beautiful selfie or photo, not at all. But the number of clients presenting these days are more and more here because they were referred by some other doctor, and the doctor was very concerned about their knee surgery or their ankle surgery or their spine surgery, or kind of surgeries which are very, very dangerous. These clients are usually more than 40, around 45, in a bracket of 45 to 60, and they are at verge of at the plan of some massive big surgery which their doctors doesn't want them to go under the knife, because they are suffering from many other ailments like diabetes or blood pressure or high cholesterol or some kind of a kidney disease, and they don't think that they are fit for anesthesia or general anesthesia or GA, and they don't consider that these clients should be taken on the operative table for 6 to 7 hours or 7 to 12 hours. So this topic of fat or weight gain or obesity has taken a very serious face in my clinic on daily basis, and I have to take it very seriously. So once I started my clinic, I had to, then started this whole research about the current and old modalities of fat loss, that what are available, and number two, that which modality is the best one for which client or which patient pool, and number four, what should I be doing best for my clients in my clinic, which is least invasive, which is most effective, which is most economical, which is very safe without risk factors, and which doesn't harm the fertility index of any of my clients, either male or female. And then eventually, I started my research. I started to research by talking to many other doctors. I started my this whole data collection at my own patients, trying these different modalities on different group of people in my friend circle, on me myself and my family members and my patients, and taking their due consent for this particular topic that we are trying to reach a proper conclusion. So, what are the modalities available these days in our modern era of 21st century? I think number one, which has been around for a very long time, is the liposuction. The most famous liposuction with or without tummy tuck or any skin stretching technique after liposuction to stretch out the lax tissue from where the fat was removed. Number two is the cryo freezing or cryo fat freezing. Number three is the number in the cryo freezing. What we do is this, that we actually numb the tissue of your tummy, and there is a machine which, because I myself had quite a few sessions of cryo freezing, that's why I know it particularly, that they actually press your tissue in between two slabs of a cold freeze ice, and then the probe on the up top of your tummy, it actually suck your muscle into it and keep it sucking and pushing and freezing. And that was actually a very traumatic experience for me. It left many bruises on my tummy, and I was not comfortable enough to take it more than 30 minutes, although the session was planned for 1 hour. Then I went back next week to complete my session, and after even taking that much pain, I never lost any inch. In spite of the fact that I was doing a good diet, a healthy diet plan, I was doing a bit of 30 minutes exercise, whatever I could have done, and I was taking whatever necessary boundaries or limitations I should have been doing while taking any fat dissolving plan. Number three is the cavitation therapy, which is quite in for last few couple of years, and quite a few of my friends got it from many centers, and which whatever they told me and whatever I admired and the kind of experience we had with it, it showed me that it was not that much effective for a good amount of people on which I tried. Number four was in my research was slimming ribs, which are quite in and quite the up thing these days, and everybody is very fond of slimming ribs. I have seen a noticeable good change in people with slimming ribs, not with four or five, but with around 10 to 12 reps. When they take that much amount of sessions, 10 to 12 sessions, there is a very good glow, and they become tone, because the amount of antioxidants and amount of anti-aging ingredients in these drips, they make you really beautiful, and you get a very nice effect on weight loss, but not very remarkable. It is better, it is good, but it is not something very economical and not something very effective. And the downside of it was like this, that the clients who lost their weight by slimming ribs. They actually had wrinkles on tummy and thighs or their love handles or their buttocks because and their underarm in this area and their shoulders. So because when they lose fat from the skin was lax and it was hanging down, causing wrinkles on the upper surface of the skin or the skeletal muscle of the skin. Number five is the solution which is called fat dissolving injections, and I tried it on quite a lot of people, including me myself. And I just had a baby, a year ago, and losing weight after a C-section is not very easy. And although I tried it on my tummy and I have seen very significant, very reasonable, good amount of inches lost on my tummy, and I find them very safe. There is no entry wound like a liposuction, like in liposuction. There is no exit wound. There is no chance of infection. There is no pre-anesthesia or pre-surgical assessment of the client. There is no need for hospital stay. It is quite economical. You don't need to tell everybody that you are getting these injections or you're trying to get rid of the stubborn fat which is making you unhealthy and giving you a lot of diseases which you don't want to carry around. So in my own particular perspective, I have finally reached to this conclusion for now, for this month of September 2022. I am sure that there are a lot of new products, there are a lot of new modalities and pipeline these days to target the obesity, which is, showing itself like a tsunami all around the world. And insurance companies and hospitals and everybody is under so much strain and pressure of extra fat, extra weight, infertility, polycystic ovarian syndrome, male infertility, and you name it, and all the diseases are because of this fat and imbalance of hormones. The basic structure of a hormone, it comes from the fat.